Funhouse active, king of the palace, rubber like Malcolm, ball up fist in the air to the fast. Hello, everyone. Thank you for joining another podcast of Dialogue with Coffee Community Culture. I'm your host, Kerry French, and joining me today is Dr. Evona Smith. She's joining me to talk about a topic that is somewhat go unnoticed. We hear about it when there's tragedies, but then they kind of fall by the wayside. She's here to join us to talk about the Black maternal health. We previously had the Black Maternal Health Week, but it's a topic that it shouldn't just be awareness for a week. It should be awareness that we talk about every single day, because there's many women, especially women of color, who have who has lost their lives as a result of the maternal health issues. And so Dr. Smith is going to help us unpack information about Black maternal health and how we can combat that. But first and foremost, I want to just get a background of you. I know you're a fellow New Orleanian, which I'm proud of. I'm from New Orleans, born and raised in New Orleans, now living in Florida. So just briefly, just give me a background of your journey.
Sure. First of all, thank you so much for having me. It's a pleasure to be on this platform to discuss such an important topic, as you said, that we don't discuss enough. I am a native of New Orleans, Louisiana, born and raised. I'm still here. I am a family nurse practitioner and a doctor of nursing practice. Look, if I wanted to leave, my husband won't leave. So I'm stuck. But I love New Orleans. So I practice on labor and delivery, actually, for several years as a registered nurse. I helped deliver babies. I worked in the newborn postpartum unit where mothers, they just had their babies, and I would help them adjust to the postpartum period, which is right after delivery. I also have worked in an emergency room setting in which I've cared for women in the emergency department and also a primary care clinic. So I have a wide range of experience with in healthcare. And so I'm a wife and mother of 5 kids, 2 grandkids. I'm a publisher as well. I published 7 books, wow. And I assisted 14 other authors in publishing. So,
oh wow!
And then my company, Builders Publishing. Yes. So that's a little bit about me.
That's that's an awesome accomplishment. But first of all, let me address the elephant in the room. You're a grandmother? Come on. That's hard to believe.
Yes.
Well, you look.
Yes, my granddaughter is 8, and my granddaughter is 5 months. 5 months now. Yes.
Well, you look marvelous. You couldn't tell me you was a grandmother. I wouldn't believe you if you'd have told me on the street. Nah, I wouldn't have believed you. So
thank you.
Let's dive into this particular topic. As I mentioned, this is something that that we don't talk about it enough. I know there are several reports out there on health disparities, Black maternal health disparities. There's several documentaries that was aired on ABC and Hulu, but the nation's maternal mortality rate has increased. According to research, nearly 40% between 20 and 21. So tell us the history of the discrimination against Black women in healthcare, if you can.
Well, as many of us know, even if we don't work in healthcare, we know that Black women have suffered when it comes to childbirth during the postpartum period for many years in this country. If we go back to slavery, we were forced to breastfeed. We were first of all, we were sexually assaulted. We were forced to give birth to those babies that were result of rape, and we were forced to breastfeed other people's children. So we gave birth in horrible conditions, sometimes in the field, while working. So it even started back then. During slavery, there was a doctor. His name is J. Marion Sims. And, many of us, they call him the father of gynecology. Well, he experimented on Black women. He performed surgeries on Black women without any anesthesia to conduct his research. So we were treated as animals. He developed a technique where he closed what they call a fistula, which is an opening, and he would perform he would test his procedure on Black women slaves. So that's the beginning of and it's been going on for years. Yeah. And that type of treatment, even though it might not be as heinous, but we still see lots of disparities in treatment of Black women in the healthcare system.
Can you tell me, and you sort of given us a history of the disparities, but as far as so this has been going on since slavery, the disparities with women giving birth and thereafter. So this is something that's not new. We just paying attention to it. Is that right?
That's right. And we're not, in my opinion, we're not paying enough attention to it. Now we do have, as you mentioned on the onset of the show, we do have Black Maternal Health Week, which is an awesome initiative. But 1 week out of the year is not enough to combat this problem. It's a public health issue, and it needs to be addressed. If we look at, you mentioned some of the statistics, 22%, I was looking at this morning, Black women receive a lower quality of care than white women in healthcare. 3 to 5, Black women are 3 to 5 times more likely to die in childbirth than white women. And Black infants' death toll is at a rate of 10.8 deaths per 1,000 live births. Something is wrong. There's a break in the chain in the healthcare system with these type of numbers in 2023.
Knowing that we know these numbers, why we're not holding physicians accountable? Is it has something to do with social economic status as well as the race factor?
I think that it's a little bit of both. It's a little bit of both. I can think, when I look back on my experiences, as I've experienced both sides. I've been a patient, and I've been a healthcare provider. Okay. So when I look back on my experiences as a patient, I can remember with my first child, which is my daughter, I was a single mom, and I was on Medicaid. I wasn't a nurse. I was in nursing school. And I remember going to the OBGYN, and the physician, the first provider that I saw, he talked down to me like I didn't know anything. The only advice he gave me on that first visit was, don't gain too much weight.
Wow.
And so, yes, that was the first and last time I saw him. I immediately went and I searched for a provider. First of all, I asked my family members and friends who I knew had given childbirth, if they had any recommendations, and I found a provider, and he was a Black provider that took good care of me. And so I see the difference now so I had subsequent pregnancies, and I had good medical insurance. I was a nurse, and I saw the difference in treatment. And even with the best medical insurance, I've had some bad experiences with providers. So I think it's a little bit of both. I think it's socioeconomic status is a factor, as well as race.
Does age has anything to do with the maternal mortality? Does, like, young Black women opposed to older Black women, does age play a role in this?
Yeah, so I didn't find statistics on age, but through my experience in practice, yes, I've seen, and I've had to advocate for Black women and men and Black children in the healthcare system, because I've seen it up front and personal. I've seen a young woman come into the emergency room in pain, and I've seen her complaints be swept under the rug, like, oh, she'll be fine, she's okay. Or even a young Black man come in, he may have a look to where they think he's not educated, which, he may be dressed in baggy pants, or, and they have this stereotype, and they just automatically, when they judge, not everyone, but the majority will judge, and when they walk in the door, they've already dismissed whatever their complaints are. So I've had to be an advocate for Black women and men and children, and my own children. I've had to.
Yeah.
Go ahead.
No, I was going to talk about, because as a healthcare worker, physician, have you seen? Well, first, how long have you been in working in as a nurse and a physician? How long have you been doing that? And another question to add on to that: have you seen these disparities up front and close?
Yes, I've seen these disparities up front and close. I've worked. I've been a registered nurse since 2003. And I'm not a physician. I'm a family nurse practitioner with a doctorate in nursing. Yes, with a doctorate in nursing. So I've been a nurse practitioner since 2009. And yes, I've seen a mother. I've seen several mothers die in childbirth. Some were from neglect. Some were not. Some just just happened, and they weren't preventable. But I've seen several deaths, maternal deaths, that could have been prevented. Now, at the time, it was because when they get to us, when I was working labor and delivery, it's kind of almost too late to catch some of these problems. Yeah. The problems are during the prenatal period, when the mom is going to the doctor once a month or twice a month. They may undermine complaints. I may complain of a headache, or I may have abdominal pain, and it may be just kind of swept under the rug until it becomes a medical emergency.
Wow.
So
being that, and I know we're going to talk about solutions. Is there, and you say you've been an advocate, so what some of the things have you suggested or recommended to people who has been treated unfairly? What's some of the things that because everyone don't have great insurance, so they're looking for someone to be able to they're looking forward to get the best possible treatment. But so what do they do? They don't have any insurance, or lack of insurance. Who can they turn to? Who can they trust?
My recommendation, first of all, even if you don't have insurance or the best insurance, you have the right to receive the care that you deserve. So you don't have to. Sometimes we're under the impression to where, I have to accept this. I have to subject myself to this type of treatment. You can search for a provider that meets your needs. You can interview providers. You can ask to meet with them and have a list of questions and fill them out to see if this provider will be a good fit until you find the provider that's right for you. Like I said, my first pregnancy, on the first visit, I was like, oh no, I won't be back here. And so I went and I did my research. I called around and I found a provider that was a good fit for me. And even sometimes, and I will say this, you may find some Black providers that aren't a good fit, because I have crossed.
That's true.
Yeah, some Black providers that aren't a good fit for me, and I have to move on. So you want to, and that's with women, with men, with your children. You want to make sure that you are comfortable with that provider, that they are attentive to your complaints, that they are thorough. Because you don't have to, no matter what type of insurance, even if you don't have insurance, you don't have to be subject to low quality treatment.
Wow. I just want to do your research. Okay, that's the number one. And I think, they can, people who will listen to this should be able to take down notes, because it's all about the consultation, about going in and be able to kind of get a feel for that doctor. You should know firsthand if that person's for you, instead of just settling. But I have these stats. In 2021, 1,205 women died either during or within 42 days of the end of their pregnancy, compared to 396 women in 2000. That is an alarming rate. How can we fight these disparities? And are we fighting against hospitals or physicians that doesn't provide the care that these women need?
It's a mixture of both. It's the system. It's the system that we're fighting against. And the really what we need to do is educate our people. We have to, if you are a healthcare provider, and that's what I try my best. If I in my church community, I'm educating on the job. I'm educating when I see patients. I'm educating them. Be an advocate. If you have family members, friends, people in your neighborhood that have healthcare issues, I've been an advocate for those patients. We have to write our legislators, make phone calls, send emails, because that's the only way. And it can't just be one or two of us. It has to be us coming together and really bombarding these government officials to pay attention and tackle this public health problem.
Wow. Okay, my next question. Well, I guess let's talk about the list, because you already mentioned, recommending people kind of do their research on physicians. What are some of the things that they can look out for to determine if that physician is the right fit for them?
Okay. First of all, you have to know you. So some women, when we're talking about, maternal health, some women that are more comfortable with another woman, or some are more comfortable with a male provider. So you have to know what's your preference. What am I comfortable with? Who am I comfortable with? If I'm looking for a female provider, well, then I need to do my research. If I want a Black provider, there's websites that you can find, blackdoctors.org, different websites that you can find Black providers in your area. You have to know what you're comfortable with. And then when you encounter that provider, pay attention, ask other patients. If you know patients of theirs, ask them, are you satisfied with the care that you receive?
Yeah.
What is it that you don't like about this provider? What is it that you like about this provider? Word of mouth. I've gotten the best doctors from word of mouth, people that I know and trust, and they've recommended physicians or healthcare providers to me. And sit down. So once you make a choice, you found the doctor that you think will be a good fit, sit down with that doctor, ask them questions, write down your questions, ask them questions, and pay attention. Are they just brushing off your complaints, or are they doing a thorough workup to find the source of your whatever your problems are?
And so you mentioned advocates. So where's a good place to find an advocate, someone who will speak on your behalf and look out for your best interests? There nonprofit organizations that they can sign up, Facebook groups or whatnot. How can one find an advocate for Black maternal health?
So you can, most of us are on social media.
Right.
There's the organization that started the Black Maternal Health Week, and I want to get the right name before it is Black Mamas Matter. Black Mamas Matter Alliance. They are a good resource.
Okay.
And they're advocates for Black women. There's also other organizations that you can, research. You can go to blackdoctors.org, find information on that website. There's information about providers, as well as there's like health updates, different educational resources there that you can, because we need to educate ourselves.
Absolutely.
Knowledge is power. The more we know, the more power we will have as far as our health. So Black Mamas Matter Alliance is a great resource for advocates for Black women. That's just one, but there's lots of them out there.
Sounds good. So outside of the medical field, you are a publisher. You say you published 7 books. I can't let you go without you discussing those. First of all, when did you become a publisher? And second of all, what made you want to get into children's books?
So I became a publisher in 2020 when the pandemic started. When the pandemic started, I always had a love for writing, and I was led to write a children's book about the pandemic to help children to learn how to take precautions in language they can understand. So the name of that book is Sophia's Pandemic World. And it's about a little girl named Sophia. And she's sad because the pandemic has separated her from her friends. This is when we were on lockdown when I wrote the book. And her mom comes in and teaches her how to wash your hands and how to properly cough and, different precautions, how to wear a face mask and different things like that. So I wrote that during the pandemic, Sophia's Pandemic World. I published a coloring book that accompanies that book as well. The second book that I published is called Breathe, and it's this is when George Floyd was murdered, and this is a book about a young Black man who is having trouble, grasping this social injustice thing that's happening in America, and he has a conversation with his dad. So it helps children to cope with social injustice. So there's a coloring book that accompanies that. So I published subsequent journals. And when you publish a book, people automatically ask you, how did you do that? Because lots of people want to read books. So I got started with people asking me, how did I publish a book? I decided to make it my mission to help underrepresented aspiring authors publish books. So that's what I've been doing. The name of my company is Strength Builders Publishing, LLC. So I've helped 14 authors so far since I started to become published.
It's ironic. I think the pandemic really forced a lot of people to get into their creativeness, because they couldn't do anything. It was nothing for them to do. They couldn't leave, or they was afraid to leave, and so it kind of forced you to go, okay, what can I do? Let me tap into this. I would always love to do it. Now I have the time to do it. Let me do it. So that what it was like for you, because I think for a lot of people, they use the pandemic to really, get into their bag, as we would like to say, and sort of their creativeness, and to make them become, publishers or entrepreneurs and whatnot.
Yes, absolutely. It actually helped me to walk in my purpose. I always loved to write, like I said, but I never considered. I really didn't have the time to sit down and write and publish a book. But the pandemic, when we were on lockdown, we had lots of time to be creative. So that's really what propelled me into this area of my life. So I appreciate the time that we all were given, because I think, like you said, with me, but many people, delved into areas that they wouldn't normally delve into because of the pandemic.
So, and how people can purchase one of your books? How can they find you on social media, just to follow your movement?
Sure. So my website is strengthbuilderspublishing.com. All of my books are on my website, my background, and if you're interested in publishing, if you're an aspiring author, you can send me a message through my website as well. You can follow me on Instagram at Dr.Dr._Evona Smith. And you can send me a DM, and if you're interested in publishing, or if you just want to connect, follow me on IG. I also provide lots of tips for authors on my IG as well. And I'm on Facebook at Evona Lee Smith. And I also have a company Facebook page, Strength Builders Publishing.
All right. Well, they should be able to find you all the resources at their fingertips. All they have to do is follow and support you. And also, if they have any aspirations of writing themselves or publishing a book, they also can see you as well. So, Dr. Evona Smith, thank you so much for joining Dialogue, Coffee Community Culture Dialogue, and I definitely appreciate your time.